Hello, my name is Riley Sena, and this is Key Informant Interviews to assess factors related to vaccination among healthcare workers in Pima County. I was brought into this class to observe qualitative analysis work as well as helping code and transcribe interviews, which is where I met the rest of my team. That consisted of Maya Block, Harrison Schmidt, Stephanie Malahan, Dr. Pranima Madivanan, and Dr. Priscilla McGrath. So the research question that we asked were, what were some of the reasons why healthcare workers may not have been getting vaccinated in Pima County? And then just for some context, Pima County is the second largest county in Arizona, containing roughly over 1 million people. Our intent was to look at the intention to vaccinate only among the healthcare workers. And like I said, it's done from a final project. Some subset questions that we had were, what advice do healthcare workers give their patients, and what are some reasons healthcare workers see their patients use to not get vaccinated? And then just as a quick background, the COVID-19 vaccine was released on December 11th of 2020, and as part of our qualitative analysis class, we looked at the intention to vaccinate among healthcare workers in Pima County. So our methodology, for our recruitment, we use snowballing and convenience sampling. Students had contacts in certain areas in the medical field within Pima County. Our sample consisted of 18 interviews with healthcare workers from 3 different groups. They were the emergency medical technicians, physicians, and long-term care, all stemming from Pima County. The ratio was 50% men to 50% women. The ages ranged anywhere from 23 to 30 to over 60. 23% identified as Hispanic and 85% identified as white. Our methods of analysis, the coding scheme that we used was developed iteratively by a team of 4 researchers using standard techniques. Interviews were coded by 2 researchers who met to discuss and resolve any disagreements and discrepancies that came up, and thematic analysis was used. So the overview, there were very pro-vaccine attitudes in general. Some differences between groups, but generally advising to vaccinate, and some are more cautious than others. And then with that caution came mentions of respecting free will and others to make their own choices. And that's kind of exemplified by the quote down there. And then moving into access, there were some challenges with the rollout for healthcare workers initially. Location and communication and those kind of things did pose certain problems. Help from coworkers covering shifts if they had to take off work. And then with that, a lot of them mentioned that they'd like to be vaccinated at work. Distribution inequities, there was difficulty navigating websites for elderly and lower health literacy patients according to the healthcare workers, and generally the physicians talked about this more than the other groups. And then going into the next slide, I only have time to present a small subset of the themes that we found. First will be hesitancy. Side effects were a big deterring factor, especially for those that were pregnant or planning to be. There were very few mentions of religious or cultural reasons, and then there were some concerns with the rate of development and uncertainties with certain technology, those certain technologies being the mRNA technology that was introduced. And then again, we just have a quote below that kind of sums that up. And 47 of our codes were coded with hesitancy, and then 14 of those codes were directly coded with misinformation, and even more than the 14 that were not directly coded were preceded or followed by a misinformation code. Moving into advice from healthcare workers, it was overall very positive and encouraging quotes for people to go out and get the vaccine. A lot of talk of benefits outweighing the risks of staying unvaccinated. Mandatory vaccination again was in question due to personal freedoms and potential long-term effects. And then there was a lot of talk of vaccination as our ticket to quote unquote get back to normal. And then once again, I just have a couple quotes down there. The benefits would outweigh the risks of not getting them, and then having to accept their risks if they do choose to go unvaccinated. And then moving into the last subset was responsibility. Vaccines were seen as a way to protect the vulnerable population and not just the individual, and that healthcare workers were seen as role models. And then in the bold, you can see that one of the healthcare workers stated that it's not about protecting you, it's about protecting your elderly grandmother, or maybe someone that you're just sitting next to on the bus. Discussion and conclusion, we were unable to obtain participants that fit our ideal set of characteristics. Overall, we were able to identify some factors that may cause hesitancy among healthcare workers and the public. healthcare workers stressed the importance of obtaining accurate information to promote vaccination. This was tied in with the misinformation that I brought up during the hesitancy slide. Participants had mixed recommendations about mandatory vaccination due to conflicting values, and then they expressed that responsibility, whether it be collective, personal, or institutional, was a key factor in pushing them to get the vaccine in the end. And then moving forward, future work may attempt to leverage feelings of collective responsibility in order to encourage those that are hesitant. And then looking at why some healthcare workers administered the vaccine but chose to hold out or not get it themselves when it was available. And then finally, just finishing up, a thank you to everyone at the Alliance for Vaccine Literacy at the University of Arizona for helping out with this project. And then a few of our other contributors and collaborators, as well as a huge thank you to the Western Region Public Health Training Center, for all the help that they provided with this. Thank you.